Have you ever thought about what the sounds of your heart are actually saying? What if I told you that one tiny, almost unnoticeable click in your heartbeat could tell a massive story about your heart's health? Today, we're jumping into mitral valve prolapse, a surprisingly common condition that really all starts with that one little sound.
So yeah, what is the story behind this click? It sounds so minor, right? Just a little tick. But you know, sometimes the smallest things can tell us the most. And in this case, that tiny sound opens up this whole fascinating window into the incredibly complex mechanics of our own hearts.
Okay, so let's dive right in at the very beginning. The whole journey to figuring out if someone has mitral valve prolapse, we'll just call it MVP from now on, it almost always kicks off in a pretty old school way. A doctor, a stethoscope, and this one really unexpected sound.
So this first clue, it's called a mid-systolic click. It sounds technical, but it's pretty simple. Mid-systolic just means it happens right smack in the middle of a heartbeat. It's not some big loud thump or anything. It's more of a sharp, kind of distinct sound that a doctor can pick up with a stethoscope. And really, that sound is the first domino to fall. It's what tips them off that, hey, maybe we should look into this a little bit more.
All right, so we've got the sound, but to really get what's causing that click, we've got to go inside the heart, right? We need to look at the anatomy of the valve itself.
Okay, think of your mitral valve like this. It's basically a set of perfect one-way doors. They sit between the heart's upper left chamber, that's the atrium, and the lower left one, the ventricle. Every time your heart pumps, these doors, which are called leaflets, are supposed to just snap shut. Boom, a perfect seal. And that's super important because it makes sure blood only flows one way, forward.
But with MVP, well, that perfect seal gets broken. When the heart squeezes down, that's what systole means, one or even both of these leaflets just don't close right. Instead, they kind of billow backwards into the atrium. The best way to picture it is like a parachute that catches the wind from the wrong direction. And that click we've been talking about, that's the sound. It's the sound of the valve tissue snapping tight as they get pushed back.
So that brings us to the textbook definition here. But I actually love the other names for it. Floppy or degenerative mitral valve disease. I mean, those words give you the perfect picture, don't they? The valve tissue itself is just a little too flexible, a little too floppy. And that's exactly why it can't hold that tight, perfect seal we were just talking about.
All right, so the doctor hears the click. What's next? Let's play detective and see how they go from just one little sound to an actual confirmed diagnosis.
Now this is what's really fascinating to me. The clues, they're not just in the heart. Of course, you got the classic click, and sometimes you might hear a murmur, which is a sign the valve is a bit leaky. But then look at this other stuff. Chest pain, palpitations, okay, that makes sense. But then you see skeletal changes, or being super flexible. I mean, things that seem totally unrelated to your heart. This is a massive clue. It tells us that for some people, MVP isn't just a heart thing. It's a sign of a bigger, body-wide condition that's affecting the very glue that holds us together, our connective tissue.
But, you know, all those signs are really just clues. The final confirmation, the moment of truth, that comes from an echocardiogram. It's basically an ultrasound for the heart. And this is a game changer because it lets doctors go from just listening to the heart to actually seeing it in action. They can literally watch the valve moving in real time and see with their own eyes that a leaflet is bulging backward. That's what turns a suspicious sound into a rock-solid diagnosis.
Okay, let's be real. Hearing you have any kind of heart condition can be pretty scary. And that's why this next part is so important to understand. MVP isn't just one thing. It's a massive spectrum, and it ranges all the way from something totally harmless to something that, yeah, definitely needs a closer look.
And just to put all this in perspective, check out this fact. You might be surprised to hear that MVP is incredibly common. We're talking up to 10% of healthy young women. Think about that. And for the vast majority of these people, it's really just something a doctor finds it causes absolutely zero problems in their daily lives.
Okay, so this slide really gets to the heart of it, no pun intended. The absolute key difference maker here is a word called regurgitation. All that means is, how much does the valve leak? So on one end of the spectrum, you've got MVP without a significant leak. You might have that click, but you feel totally fine. No big deal. But on the other end, the more serious end, the valve is leaky. Pretty leaky, in fact, and that's when you get the click plus that murmur we mentioned earlier. And that combination, that's when doctors really start paying close attention, because there's a risk of long-term problems.
So what does that risk actually look like in real numbers? Well, let's take people over the age of 60 who do have that significant leak. Out of that group, about 2% of them per year might eventually need surgery to fix it. Now, that's not a huge number, right? But it's not zero either.
And it's exactly why monitoring is so crucial for folks on that more serious end of the spectrum.
All right, so let's talk solutions. What can we actually do about it? Let's wrap things up by looking at how MVP is managed today, and it's a whole range, from simple medications to some really, really cool surgical repairs.
So for a lot of people, especially on that more benign end, treatment isn't even about fixing the valve. It's all about managing symptoms. See, some people with MVP have a system that's kind of stuck in overdrive, a higher adrenaline response, and that can cause that racing heart feeling, maybe some anxiety. For them, a simple low-dose beta blocker can be a lifesaver. It just helps calm that whole system down.
But what if that leak is bad enough that you have to do something about it? Well, the goal today, the absolute gold standard, isn't to just replace the whole valve. It's to repair the one you already have. And the techniques they use now are they're amazing. I mean, surgeons can go in and tighten the little heartstrings that support the valve. They can trim away any extra floppy tissue, or even put in a special support ring to help the valve close nice and tight again. It's basically like high-tech carpentry for your heart. Just incredible stuff. And all of this really brings us to the single most important takeaway, the big rule of thumb. If a doctor hears more than just the click, if they also hear that murmur that signals a leaky valve, then it is absolutely time to see a cardiologist. At least once. You just want to make sure an expert has taken a good look and could help figure out the right game plan for the long haul.
So there you have it. Mitral valve prolapse. It starts with this tiny little click. But as we've seen, it covers this huge spectrum of possibilities. You know, the big question for the future isn't just about finding better treatments. It's really about prediction. How can we get smarter about figuring out which people are going to stay on that harmless end of the spectrum forever, and who are the ones that might need a little more help down the road? Cracking that code, that's the next big challenge for cardiologists everywhere.